You know, every time you go to the doctor or dentist, there's this hidden game being played. It's a really high stakes match with some seriously complex rules where just one wrong move could actually cost your doctor or your healthcare provider their entire career. And this isn't about the medicine they practice. It's about this massive invisible rule book they have to follow just to get paid. So let's dive in and figure out the rules of this hidden game. Okay, so we all know that a huge medical mistake can have really serious consequences, but there's another threat out there, the one that's often kind of silent and administrative, that can bring a practice to its knees just as fast. So, what is this other thing? Well, the answer is healthcare compliance. Think of it like this massive tangled web of billing codes, documentation rules, and anti-fraud laws that govern every single thing that happens in a clinic. For doctors, that's a total minefield where a simple paperwork error can look a lot like fraud and the results can be devastating. All right. So for every single thing your doctor does, from a simple checkup to complex surgery, there's this whole other layer of work happening behind the scenes. And this is the world of compliance. And believe me, that's where the real risk is. And the consequences here are not small. I mean, we are not just talking about one little denied insurance claim. We are talking huge repayment demands for work they have already done, massive financial penalties, and even losing the ability to see patients on Medicare or Medicaid. So, how on earth is a doctor supposed to navigate this maze? Well, luckily, there's an official playbook, a framework that's designed to keep practices on the right track, and most importantly, to make sure patients are protected. Let's take a look at what's in it. Okay, so the government's own watchdog, the OIG, they lay out these 7 core rules. And instead of just reading a list, let's think of it in 3 simple parts. First up, you need a blueprint. That means written policies and someone officially in charge. It's all about having clear rules. Then you've got to be consistent, constantly vigilant. So, ongoing training, open lines of communication, so staff can actually report problems, and regular audits to check your own work. And finally, you need enforcement, clear disciplinary rules for people who break them, and a solid plan to fix any mistakes that you find. For any practice that sees Medicare or Medicaid patients, this isn't just a friendly suggestion, it's a requirement. So, who is this OIG anyway? Well, you need to think of them as a federal referees in this whole game, right? The Office of Inspector General is the main enforcement group for programs like Medicare, and their job is to hunt down fraud and abuse, which means they are the ones who will come knocking if the practice is not playing by the rules. Okay, I know these rules can sound kind of abstract, right? So let's make it real. Let's look at how this all plays out in the real world with some concrete examples of compliance traps the doctors face every single day in different specialties. Let's kick things off with cardiology, a field with all this high-tech gear and some really big bills. The sheer complexity of their work creates some pretty unique ways for things to go wrong on the paperwork side. And the risk here, they get they get surprisingly specific. For example, Office of Inspector General has actually gone after cardiologists for overcharging for drugs used in nuclear heart scans. Then there's this other trap called unbundling. Unbundling is basically like ordering a combo meal at a restaurant, but then getting charged for the burger, the fries, and the drink all separately just to squeeze more money out of you or out of federal programs. In this case, it's a huge compliance no-no. All right, next up we have pain medicine. Now, this specialty is under a huge microscope, especially with opioid crisis, and the compliance pressures they face are just enormous. And this right here, it just shows you the tightrope these doctors have to walk. A compliant practice, a compliant pain medicine practice, they're using state databases to track prescriptions. They have strict agreements with their patients. A non-compliant one might be prescribing recklessly. And here is something I found pretty fascinating. Even something as routine as a drug testing can become a trap. It's totally fine when it's for patient safety, but it flips into straight up fraud when doctors order tons of unnecessary tests just because they're getting a kickback from the lab. And now you might be thinking, what about other specialties like dermatology? Dermatology, that sounds pretty low risk, right? Well, think again. Even in a specialty like this, the potential for major compliance problem is very, very real. And this is a perfect example of how blatant the fraud can be. I mean, we are talking about a case where dermatologists were billing Medicare for these super complex skin cancer surgeries that either were needed or, get this, never even happened. It's a pretty stark reminder that even in common specialties, the temptation to bill for more can lead people down a really dangerous road. Okay, let's switch gears and talk about dental world for a minute, because it has its own unique set of rules with some surprising and pretty specific compliance challenges, especially when public insurance programs are involved, such as Medicare and Medicaid. See, Medicare usually does not cover routine dental stuff, but it does cover some procedures done in the hospital. An OIG audit looked into these claims and found that staggering 65% of them, almost two-thirds, were non-compliant. That led to millions of dollars in improper payments. So one of the biggest lines in the sand of dental compliance is this difference right here. Medically necessary work fixes a real health issue, and insurance often covers it. Now, a cosmetic work is all about appearance, and the patients have to pay for that themselves. And this is where it gets dangerous when a provider tries to bill insurance for purely cosmetic stuff by pretending it's medically necessary. And this whole issue gets even more sensitive when you bring kids into the picture, especially in pediatric dentistry. Medicaid provides really comprehensive coverage for children, which unfortunately creates a huge target for potential fraud. I mean, federal investigators have found some absolutely heartbreaking schemes where pediatric dentists performed way too many unnecessary procedures on kids, all just to bill Medicaid. We are talking about doing baby root canals and putting crowns on teeth that just needed a tiny filling or maybe had no decay at all. It's just the worst kind of non-compliance you can imagine, where greed literally hurts a child. Okay, so we have talked a lot about the risks for doctors and dentists, but why should you, as the patient, care about any of this? Well, it turns out a good compliance is actually a really good sign of good medicine. Seriously, when you are sitting in that chair, how does all this paperwork and behind the scenes stuff actually impact the care that you're getting? It's simple, really. A practice that's serious about compliance is a practice that respects you. It means they are only going to recommend treatments you actually truly need. It means they have systems in place to to protect your private information and your safety. And in the end, it prevents the kind of fraud that makes healthcare more expensive for every single one of us. Good compliance is really the foundation of trust. So next time you're at the checkup, just remember that hidden game that's always being played, and make sure you go to the practices that are playing this game really well and they're ahead of their game with their compliance programs and the way they treat you as a patient. A great doctor isn't just focused on your health, they're also focused on playing that game with absolute integrity, because when they play the game the right way, well, that's how the practice win in the overall picture, and that's how patients win too.